Okay.
Good evening, one and all. Welcome to the webinar on COVID vaccination myths and truth. The program will start at 6 o'clock. I request all of you to be with us till the end of the program. The speaker is ready, and I request all of you to mute your camera and also the mic. And if you have any questions, please type in the chat box. Selected questions will be asked, and the speaker will be ready to answer the questions. And based on the availability of the time, we can he'll be able to answer the questions. So, and also the feedback link will be shared in the chat box. Please click on the feedback link, complete the feedback form, and after that we'll be able to send the participation certificates to you later. I hope you can maintain the decorum of the webinar. I request all of you to mute the camera and also mic and type the questions in the chat box. Thank you very much. The structure of the program will be like this. To begin with, there will be overview of Swadeshi Vijnana Andolana Karnataka and the welcome speech. Later on, the speaker will be introduced, followed by the question answer session. After that, there will be vote of thanks. The program will end with the vote of thanks. I request all of you to stay with us till the end of the program. So we will about to start the program in 5 to 6 minutes. Thank you. ರಮೇಶ್ ಶುರು ಮಾಡಿ 6 ಗಂಟೆಗೆ ಪ್ರೋಗ್ರಾಮ್ ಶುರು ಮಾಡ್ಬೋದು ನೀವು ಈಗ ಮಾತಾಡಿದ್ರೆ 3 ನಿಮಿಷ ಇದೆ
1 second.
6 ಗಂಟೆ ಕರೆಕ್ಟ್ ಆಗಿ ಉಮೇಶ್ ಮಾತಾಡ್ತಾರೆ
Namaskara and welcome to you all for the good evening. Welcome to you all for the today's webinar. And on behalf of the Swadeshi Vijnana, I would like to take this opportunity to welcome you all. And also, I would like to take this opportunity to thank our founder pattern, Professor K. Vasu, who was a professor in IISc, and he was also a director for Central Electrochemical Research Institution, Karipudi. Presently, he is in Bangalore. Who is the founder of Vijnana Bharati. It's an all India organization. The Swadeshi Vijnana Karnataka is a Karnataka state unit of Vijnana Bharati. So we are running here past from 18 years. And our present is Captain Ganesh Karnik, who is an ex-army man and also a former MLC of Government of Karnataka. I would like to thank Professor K. Vasu and Professor Captain Ganesh Karnik. And also our Dr. Renuka Prasad, who is also present today, who is also a working president for our Swadeshi Vijnana Karnataka, and many of our all the district units, secretaries and presidents are joined today. I'll welcome you all the people, and also I'll welcome Dr. Umesh, who is also a secretary for our Bangalore unit, and Dr. Girish, who is also a convener for our Dhanvantari Vedike, Dr. Radhakrishna, who is the host monitoring all the programs, today's program, who is also a joint secretary for our Swadeshi Vijnana Karnataka Bangalore unit, and Dr. Shivanna, who is also our IT cell convener, and all the other dignitaries and all the other our members. I'll take this opportunity to welcome you all. Now I'll give over to you, the Dr. Radhakrishna sir, to take over the program, all the programs.
We will start after 1 minute, sir. We'll start exactly at 6 o'clock. Good evening, one and all. Welcome to you to the webinar on COVID vaccination myths and truth. Swadeshi Vijnana Andolana organizes many webinars like this. So thank you for coming online. The program will start now. I request all of you to be with us till the end of the program. The program will end with vote of thanks by Dr. Girish. So now, to begin with, I request Dr. Umesh, who is the scientist at Philips and also secretary to Swadeshi Vijnana Andolana Karnataka Bangalore Center, to speak about Swadeshi Vijnana Andolana Karnataka and welcome the gathering. Thank you, sir.
Good evening to all. Thank you, Radhakrishna sir. Welcome, Upadhyaya sir. Welcome to the program, and all the participants, welcome to the program. As our General Secretary, Dr. Ramesh just said, Swadeshi Vijnana Andolana Karnataka is a science organization. We have been organizing different programs. I would like to give a very brief introduction about what we do, what is our background, and what our motivations are. And then maybe I'll introduce the speaker very shortly before you hear the all-important lecture today evening. So Swadeshi Vijnana Andolana Karnataka, or SVAK as we call it, is a vibrant non-profit science movement. We actually have a Swadeshi spirit in what we do, and we have intense concern for our Indian contributions to science, be it past, present, or future. We passionately care about how India's scientific heritage continues, how its traditions in science continue, and how we can retain and enhance scientific thinking and communication in Indian languages especially. Wherever our past contributors to science, present scientists, educators across different disciplines, and we strive to foster a scientifically minded society without losing touch with our culture or history. As Ramesh already mentioned, SVAK was founded by Professor K.I. Vasu in 2004. He was a faculty in University of Science with the goals just I mentioned, to make sure that Indian science also takes along with it Indian languages and traditions. So after having founded SVAK, Professor Vasu went around the whole country to different states and tried to encourage people to build similar organizations at state levels. And after a few years, this culminated in multiple state units being formed. And finally, this came under the umbrella of Vijnana Bharati, which is at the national level, the body which actually presides over all the state units. SVAK is working as probably one of the most important and vibrant units of Vijnana Bharati. We have presence in 25 districts of Karnataka. We have more than 1,000 life members. And our life members come from very different disciplines. Some of them are educators, as you would have guessed. Some of them are scientists. Some of them are directors of research labs. We have software professionals. We have even agriculturists. We have politicians. So since science touches everyone, we have a very broad spectrum of people who call themselves as members of SVAK. Because of this, we also organize programs across different disciplines, be it in hard sciences like physics, chemistry, or engineering, for example, whether it's ISRO-based, achievements, or whether it is something completely to do with medicine, for example. We also encourage Ayurveda and even musicology and different aspects of science, which traditionally India has regarded as part of science. So with this background, I would say we typically organize two major programs every year. One of them is Kannada Vijnana Sammelana. And in this 3-day conference, we have people across the Karnataka state coming and presenting scientific works in Kannada, discussing and communicating it in Kannada. So this is a very unique conference, which typically you won't find anywhere else. And we are very proud of having organized this year over year for a long time now. And besides this, we have a national program, which is called as a National Women's Science Program, a National Women's Science Congress, where we encourage members of SVAK to organize a national level meet of women scientists in India. And that builds bridges across different states. We have been organizing this in Karnataka for a long time. Now it's going to go out to different states as well. So these are broadly our activities. We also plan to do activities at schools and college levels. We also have memoranda of understanding with different universities about conducting programs. And given what we are going through as a country in this pandemic, we have been restricted to do our activities online. And this is one of the programs which we think is really apt under these circumstances. So we have been organizing a lot of popular programs. This will be one of them. Since this is a volunteer-led organization, it'll really mature and prosper only if we have a lot of participants coming and taking part in our activities and also joining hands with us. So I will share some contact details with you later. Please, if you like what we do and if you think you can help us, please reach out to us. We'll be very happy to talk to you and work along with you. So having said that, I shouldn't take more time in bringing the focus back to the topic of today's talk about the COVID vaccines, myths and facts. We have a very eminent speaker with us, Dr. Upadhyaya, who is probably tailor-made to give this lecture, let's say. I'll give a very brief introduction about him. Professor Upadhyaya started his studies in microbiology, chemistry, and zoology with a bachelor's in St. Joseph's Arts and Science College in Bangalore. Then he went on to do a medical microbiology degree at Kasturba Medical College in Manipal. Later, he got his PhD degree also in microbiology from Rajiv Gandhi University of Health Sciences in Bangalore. Professor Upadhyaya has a long association with Kempegowda Institute of Medical Sciences, KIMS. Since 1997 to 2014, he has been an assistant professor there. After that, he became an associate professor. And in 2018, he became a professor of microbiology. And since January and since 2020, April, he has been made the person in charge of the COVID molecular lab. And he has also undergone special training for COVID testing. So that's something which is very relevant to what he's going to speak today. Besides being in education, he has also been a researcher. He has published in 9 articles in national and international journals. And his research is not just related to COVID, but he has a very broad area of research under his belt. He has researched on children suffering from meningitis and pneumonia, for example. He has done a lot of work on malaria, has done a lot of work on HIV and AIDS, and has written a book for nursing students. So all in all, he is a well-rounded educationist and a researcher, and he has been teaching medical microbiology to students from different disciplines, be it in medicine and surgery or dentistry or physiotherapy. So he has been teaching microbiology for various kinds of people. Apart from education, he has also been very active professionally. He has been a consultant with a lot of clinical labs in Bangalore. He has been working with 6 reputed diagnostic centers, and he carries out routine examinations, diagnosis, reporting across all these different centers. And as I mentioned, Professor Upadhyaya has worked extensively on HIV and AIDS. He has delivered more than 300 lectures on HIV prevention, and he has even participated in drives to prevent HIV and AIDS. And he has taught a lot about this across different sectors over the last decades. And apart from this, he has also been a master trainer of for the psychology department in Bangalore University, has been a treasurer of the Indian Association of Medical Microbiologists, and he has been a managing committee member of the Mythic Society in Bangalore. And he's also a resource person for an NGO called as Samraksha. So this is about his professional and educational career, let us say, but he has a very vibrant dimensions as well. He has been active in dramatics. He has won several prizes at intercollegiate competitions in drama. He is interested in singing, elocution, and debating, and he plays cricket, politics, and political debates. And so he's a very versatile person. We are very happy to have you here, sir. It's with immense pleasure that we welcome you. We are sure that our participants will benefit immensely by listening to you about this topic, which is very apt at this time. So without much ado, I would like to hand it over to Radhakrishna sir and you to continue on the topic of focus today. That is the.
Go to the Honorable Speaker, Dr. Giridhar Upadhyaya, please.
Thank you. Thank you very much. Thank you very much for that wonderful introduction, Dr. Umesh. Rashtra Devo Bhava. Let me start my talk about what we are undergoing now at this point of time. The positive news is the number of cases of COVID, which was on a rise for some time, is coming down. At least I can feel that in our hospital. At least I can feel that pressure which has come down from the last 3-4 days. I can tell you a week back or 10 days back, I used to get around 200 calls every day. Somebody asking for a ICU bed, some other person asking for a oxygen supporting bed. Around 200 calls I used to get. Or somebody asking what is the condition of a patient who is admitted in our hospital. But gradually it has come down. Yesterday was the first day where I did not even get one call, somebody asking for a bed at least. That means the number of cases are coming down. After saying that, I don't want to make everybody get into complacency, because that is the one which gave us the problem in the second wave. We have to take care of ourselves. Let me tell you, last year when the corona started in the beginning, we had only 3 astras, only where we were able to protect ourselves. And that was mask, social distancing, or physical distancing rather than social distancing. And the third point was sanitizer. But since January 16th, or for some other countries, it started a little earlier than that, we have the 4th weapon against this virus, and that is the vaccination. The vaccination program in India was started on 16th January. It was launched on 16th January, and it was planned out very well. Let me tell you, many people may say that we have not vaccinated even 5% of the population. All those things I can answer a little bit. For another 20-25 minutes, I will just talk to you about the vaccines which are available, and what are the pros and cons, and how do we go about the vaccination program and all those activities. I give little more time for question and answer session, because many a times questions, dialogue is better than a monologue from one side. The vaccination program is started on the exactly it started around January 16th, and initially the vaccination program was applied only to the healthcare workers. Later on, the frontal warriors like the policemen or the Group D workers, then the soldiers, they were given the vaccine, and later on it opened up in the phase 3 to the senior citizens and all those citizens who had comorbidities like diabetes, heart disease, hypertension, all those. And then it opened for 45 years and above. And from May 1st, it was open for 18 years. And from then we are having a slight problem. There is a glitch in the vaccination program, which we can see. And I can assure you, in the first week of June or something, everything will be streamlined and everyone will get an opportunity to take the vaccine. At least I can 100% I can assure you on that aspect. Now, when the vaccination program started, there are many people who are very apprehensive or who are talking very negative about the vaccine. They were saying the vaccine is something which is going to kill us. It is going to have a lot of side effects. Let me tell you one thing. Any medicine or any vaccine for that matter, vaccine which you have already taken, whether it is for tetanus or for diphtheria, all the vaccines, all the medicines which we take do have side effects. That is there. It is not just for COVID vaccine alone, but the chances of somebody having this side effect is so minimal that we should be thinking about the rest of the people who are protected against the disease by taking this vaccine. Even if you take crocin also, some people are allergic to paracetamol, or if you take paracetamol for a long time, then you can have some issues where you can have a kidney failure also. The drug has what you say, the one which is taken by almost everybody, paracetamol itself has some side effects. And what is the chance of these side effects? It can be 1 in 10 lakh. Every 10 lakh people, one person can have that. That doesn't mean that the other 9,99,999 people should be exposed to the virus and should have the risk of getting the disease. So any vaccine will have its own problem or side effects. And the two vaccines which are very much available in India are the Covishield and the Covaxin. And just 3 days back, the Sputnik vaccine is also available in India. But the indigenous vaccine, or the one which is manufactured in India, is the Covishield and the Covaxin. And Covaxin is a totally 100% indigenous vaccine. Now, both the efficacy of both the vaccines are almost same. Around 70 to 80% is the efficacy of the vaccine as per the studies which has been done. If you ask me how long it stays or should I take a booster dose, let me tell you one thing. This vaccine was given permission on an emergency basis by the government of India, because any vaccine, it takes a long period to produce and to put into the use. But this is one vaccine which came into use in a very short period of time. So whatever study which has to be done is an ongoing study regarding the efficacy, how long it will stay in the body, the antibodies, all those things is an ongoing study. And only later on we can say whether we require a booster dose or not, that aspect. And about the side effects of the vaccine, there is a study which is done in India which says that the number of side effects which has been seen in the individuals are 0.61 per million. That is a side effect which is seen in India. And I'll give you the list of side effects, or anybody who takes the vaccine, what are the ticking points which he has to look into, and if he has any problem, immediately he has to meet the doctor. But it is only 0.61 per million. That's very, very negligible in terms of the number of people who are protected against the vaccine. The vaccination program, it started on 16th, as I already told you. I just want to share some of the images. And give you a picture about how exactly the vaccination program started and what exactly is happening at this point of time. I hope you are able to see the screen. Somebody can just.
Yes, sir. Yes, we can see.
Yes.
Yes, sir, we can
Okay.
see. We can see.
Okay. Okay. See, this is how the vaccination program was brought into existence, or how it is running about. It is very scientifically done. Remember, India is a country of a population of 137 crore people. You can't vaccinate everybody within a fortnight or within 3-4 months. It's going to take a long time. Even a small country like Israel itself, the vaccination program is not at 100%. Even though Israel is the first country to say that they can be free from mask, and at least everybody has the first dose of vaccine. One of the most developed countries, USA, which has a population of maybe 1/4 of or 1/5 of India, the vaccination program is only about 50% or 60%, which is carried out so far. So this is the phase out of the vaccination program which happened, and this is how it was opened up. The sorry state of affair was, believe it or not, some of our healthcare workers themselves did not take the vaccine. I can't talk about the rest of the population, but at least I can tell I was shocked when I heard some of the doctors. Yesterday, there was a report that 270 doctors have died because of COVID in its second wave, and only 2% of them were vaccinated. All the others who were killed because of COVID did not take their vaccine. That is very, very shocking. And the vaccination, even though it has an efficacy of 70 to 80%, I'll assure it is assured that whoever has taken the 2 doses of vaccine and a month after that, if he has got an infection, he has not gone into ICU. You have not seen any severe cases of all those people who have taken the vaccine. They could have a asymptomatic infection or a mild or a moderate infection, and beyond that, there was no severity of the disease in any of those people who had taken the vaccine. And I told you, India's vaccination program was one of the fastest one. We reached around 16 crores in 109 days, and 17 crores in 114 days, and 18 crores in 120 days. Whereas a very well developed country who has all the infrastructure like USA or China, they took a longer period to reach this number of doses. Today we have around 18 crores, 50 lakh doses of vaccine which has been given to the Indians. That is a large number of vaccine which has been given to the Indian population. Now, the next aspect is, what is the gap between the first and the second dose? Many of you have this doubt in your mind. Now, there was initially, the Indian government had asked everybody to take the second dose of vaccine around 4 to 8 weeks after the first dose. That was on label. But there was a study in Oxford University. I told you, most of this is an ongoing study. There was a study in Oxford University where accidentally some of the people who took their second dose of vaccine was after 8 weeks, 10 weeks, 12 weeks. And the study showed that those people who took the vaccine little later, after 3 months, they had a better immune response when compared to somebody who had taken the vaccine within 6 to 8 weeks. That's why Government of India came with a new schedule for the second dose of vaccine. That is a Covishield vaccine I'm talking about, which is around 12 to 16 weeks. You can wait up to 16 weeks to take the second vaccine. But with respect to Covaxin, the gap between the first dose remains, it is not 4 to 6, it's 6 to 8 weeks. Up to 8 weeks, you can wait for the second dose of vaccine. That is what is the program, which is a slight change in the schedule of the program which has been done. I already told you this number of vaccination has been given till 8 a.m. this morning. That is around 18 crores, 58 lakhs, 9,300 doses of vaccine has been administered. That's a large chunk of the population which has been vaccinated in terms of number. But if you go in terms of percentage, I do agree it is very less. But in a country like India, you can't have this program like a pulse polio program. Many people are telling pulse polio program was a success. Why don't we do it like the pulse polio program? It's not possible, because pulse polio program was a 4 drops of the pulse polio oral drops which was given. and there was no side effects or there was no immediate reaction for the vaccine. So there was no requirement of monitoring of the patient. But today, if you go to a vaccination center, you are given the vaccine, you are asked to wait for about 20 to 30 minutes there, and they'll monitor you, because if there is any adverse reaction, immediately it has to be taken care. So you can't have a door-to-door vaccination program with respect to the COVID vaccine. It has to be in a center where at least there should be a nursing staff to assist in case if we have any adverse reaction. So you can't have the program so fast as the pulse polio program. Yes, in a short period of time, you cannot get the entire country vaccinated. But one thing is sure, India is doing its best to get its entire population vaccinated, because there is a ramping up in the production of the vaccine. You can see there the current capacity of Serum Institute of India is around 65 million, that is 6.5 crores per month, which will be increased to around 100 crores, 100 million, that is 10 crore vaccines per month. Covaxin, the indigenous vaccine, was around 2 crores, but it will be increased to around 5.5 crores. I'll tell you, it's not so easy to increase the production of the vaccine, because it is not the technology involved, or the production lab has to be a type 3 lab, biosafety type 3 lab. And we have at present the Covaxin, Bharat Biotech has only 2 such labs, one in Bangalore and one in Hyderabad. Now, there will be another lab coming up in Bangalore, and there is already another lab which is established in Hyderabad. So by the end of this month, you will have 4 labs. And in the month of June, you will have one more lab, which is put up, which they already started putting up in Pune. So you'll have 5 labs, and the production will increase to around 5.5 crores. And the Reddy's lab has already got the Sputnik V vaccine from Russia. It has already done the bridge study, and it has given good results. The bridge study, presently the only around 0.3 million doses are being manufactured. In our own Karnataka, Raichur, somebody has got the license for this production. So it will increase to around 12 million in the month of July, and later on, by the end of December, you'll have the number of vaccines required for the entire population. There are a few other vaccines which are down the lane. One of them is Zydus Cadilla's vaccine. In our own hospital, the bridge study is going on at this point of time. And you may get a nasal vaccine, which will be which can be used with children, and there it can be used as a pulse polio program. The nasal vaccine is produced by Bharat Biotech. It will be a really game changer if we get that nasal vaccine, because it becomes easy for a country like India to vaccinate its entire population with such a nasal vaccine. Many people ask why the Pfizer vaccine or the Moderna vaccine was not taken by the Indian government. Let me tell you, Pfizer, a company, has so many clauses before it wants to give us the vaccine. And some of the South American countries which have signed the agreement with the Pfizer have changed the constitution of their country. Remember this. There is a very big pharma mafia, I can tell, which works behind and tries to pressurize the government. And Pfizer, there are 3 problems with Pfizer vaccine. One of them is its storage. They say that it requires around -70 deep freezer for the storage, which is a very big logistic problem in a country like India. The second aspect is they are not ready for a bridge study. They're still negotiating, but till this point of time, what is this bridge study? At present, the vaccination has been produced and the study has been done only in place in US. They have taken the US citizens and they have done a study on them. Any vaccine which I want to use in India, before it is used to the Indian citizen, there should be a study which is done within the country to find out what is the efficacy of the vaccine. Because genetically we are different, and genetically in other countries, the reaction for the vaccine may be different. So only when you do an indigenous study, and if we get a proper result, then only a vaccine can be approved. And Pfizer is not allowing, or they are saying you have to look into our study which is done in some other country, and on the basis of that you have to give an approval for this vaccine, for which Indian government is not ready. And there is another vaccine, Moderna. Moderna has agreed for a bridge study. Once the bridge study happens, You can even get Moderna vaccine in this country, but it's a costly affair. The Pfizer and the Moderna vaccine are very costly. It could be anywhere ranging from 2,500 to 3,500 rupees per dose, the vaccine which will be available. Anybody who has that money and who is ready to afford, they can take, but provided the bridge study has to happen. With regarding to Sputnik, there are two Sputnik vaccine. At present, there is Sputnik V, which is a 2-dose vaccine, and they claim an efficacy of 90%. They are saying in Russia, they have done a study and they claim an efficacy of 90%. We don't know at present the Indian study's result. There is one Sputnik L, which is a single dose vaccine, which will help India vaccinate its entire population faster, but that will be available only in the month of June or July, the Sputnik L, and it's a single dose vaccine, and they claim that it has a efficacy of around 85%. So we have to wait for another month or so that every Indian who is eligible to take the vaccine will get the vaccine at the right time. Hopefully, it will be in the month of July, where the entire program will be streamlined. And the central government has so far given 20 crore doses of vaccine to the states and union territories free of cost. Even today, all those vaccine which is given for above 45 years is the vaccine which is given by the central government. And that is the number of vaccine which is being provided free of cost by the central government. If you ask me what is the amount of vaccination which our state Karnataka has gone so far, it is little more than this, because this is as of 15th May. You can see there 1,18,97,440 doses have been supplied to Karnataka, and out of that 1 crore, it is more than that now. 10,65,845 doses of vaccine has been given so far, and Karnataka government has already placed a global tender to buy 200 million or 2 crores of Covishield vaccine and 1 crore of Covaxin, which they are going to buy shortly, so that the vaccination program can go smoothly in the coming days. And this is the picture of yesterday's, or 18th May, 7 a.m. The number of beneficiaries of the vaccine which has been given all over India. The percentage, at least 13.15% population of Karnataka has been taken, are being given 1 dose of vaccine. And if you talk about the other states, highest is in Jammu and Kashmir. As you know, the population is less, around 29.43%. Followed by few of the other states where it is more than 20, but average it is around more than 15 to 16% of the population in many of the states which is already taken the first dose of vaccine. I already told you, does the vaccine has any side effect? Yes, the National Adverse Event Following Immunization Committee, they have come across, they have done a study on all those people who have done the vaccine, and they have found that 0.61 cases per million doses, they had some problems after taking the vaccine. And what are those problems which can be there? It is just put up here on the screen. If anybody who has taken the vaccine and has these problems, immediately they have to consult the required authority or the doctor and take the prescribed medicine which has to be given. In India, it is very, very negligible, 0.61 cases per million. Where in UK, it was around 4 cases per million. In India, it is very, very less. So far, whatever adverse reaction which has been seen. The mild adverse reaction is a part of this thing. If you will have body ache, some people can even have fever with Covishield vaccine. 1 or 2 days, they can get the fever. Let me tell you one thing, vaccine is not medicine. Many people think that if I take vaccine today, tomorrow I am free from getting the infection. Absolutely not. Medicine is something which is to cure a disease. If you have typhoid, if you are given an antibiotic, the antibiotic will kill the bacteria which causes typhoid and you get cured of the disease. But a vaccine is not something to cure. A vaccine is to see that you get protected from the disease. So when you take a vaccine, it takes some time for the body to elicit an immune response and the antibodies to be produced in our body. And with a single dose of vaccine, the amount of antibody which is produced is not enough to protect you. That's why there is a 2-dose which has to be taken within a gap. When you take 2 doses of vaccine, it is said that around a month after 2 doses, you get the requisite amount of antibody, which is protective against the disease. And there are a few people who may not elicit that much of response. That's why the efficacy of vaccine is around 70 to 80%. And those 20 to 30% may not have that level of antibody through which it can prevent the disease. But even those people, if they get an infection, they'll have very mild infection. That is something which has to be remembered. A vaccination will only give you protection only after the second dose, and sometimes around a month after second dose. So in spite of taking the vaccination, it is very important that you also wear the mask, and physical distancing is a must, because the efficacy of vaccine is not 100%. And finally, I would like to tell that many TV channels are showing as if in India, there are hundreds and crores of people who are dying. The death rate in India due to COVID is very, very less. It's only 1.1%. It is only 1.1%, let me tell you. And if you compare that with so many other countries, which is much higher, a country like USA itself has a death rate which is around 177 per million, while India has only 18 death rate per million. A country like USA, which has a population of 32 crores, already 5,81,000 people have died. Forget that. Let us compare ourselves to UK, because UK's population and Karnataka's population is almost same. In UK, there has been 44,50,578 cases, and the death is 1,27,865. A very, very high 2.9% death rate. In terms of percentage also, it's very high. And per million, 191 deaths have been occurred in UK. In comparison to that, the death rate in India is very, very low still. So that aspect we have to remember, because many people are misleading us and telling that the government is misleading. They are not giving the proper picture about death. You cannot cheat the people. You cannot cheat with the number of cases of this COVID or the death rate. For the simple reason, every test which is done gets uploaded into the ICMR website. Whoever has got an infection would have got an SRF ID. Every case. So the number of cases cannot be decreased as we want, and even the death occurring because of COVID also cannot be decreased. That is something which you have to keep in mind. This information, what I have given in this chart, is not an Indian this thing. It is Johns Hopkins University's statistics. So many people can say that if we are Indians, so we are trying to fudge our figures. This is Johns Hopkins University's figure, which says or gives a clear picture about the number of infection which is seen in India. So with that, I would like to end my talk here and then allow some questions.
Sir, thank you very much. There are no questions typed. Of course, there is one question, 1 minute. I'll read just now.
Okay.
So there's a question from Umesh Rudrapatna.
Okay.
How often should the vaccine be taken? Every year?
No,
and the question continues. The question continues. We hear that this is not a one-time solution. That's the question from Umesh, sir.
Yeah, let me tell you, I told you in the beginning itself, it's an ongoing study about the vaccine. At present, they are saying if you take 2 doses of vaccine, the immunity can range from 8 months to 12 months or a year, 8 months to a year. And they may ask us to take a booster dose depending upon the ongoing study now. Still, the study is going on, whether a booster dose has to be given. And there is one more glitch here. This is an RNA virus. Viruses are RNA and DNA virus. The notorious thing about RNA virus is they undergo mutation. Already this virus itself, the COVID virus itself, has undergone 4,800 times mutation. That means the virus which was seen in Wuhan in the 2019 November, and the virus which you are seeing today has undergone mutation more than 4,500 times. So tomorrow, if there is a drastic mutation in the vaccine and the virus, and whatever vaccine we have produced, that particular part of the virus also against which we have produced the this thing, if that also undergoes some mutation, then there should be a change in the vaccination also.
Okay,
Yeah,
sir.
now it's a spike protein. Against the spike protein, antibodies are produced. Whatever is we are injecting to you is nothing but the spike protein of the virus. Imagine the virus undergoes some mutation in the spike protein in a drastic way, then the vaccine at present one which is given may not work. At present, it is working against all the variants. Then there should be a change in our vaccination program, or a new vaccine should come into existence. That is what is happening with respect to H1N1. Your swine flu also. The vaccine keeps changing depending upon the swine flu virus.
Yeah. So there is one more question of the same kind. How effective are the vaccines against different mutations? Are some vaccines better than other?
No, at present, all the vaccines, they say they are very effective against the mutation. If I say this, maybe people who have taken Covishield have a doubt in their mind. That's why I don't want to venture into it. The White House has done a study and they have found that the Covaxin is effective against all the variants of the virus. And even Covishield also, the Oxford University has done a study and they have found that whatever double variant, African variant, UK variant, against all those virus strains, it is effective because drastically there is no change in the spike protein. That's why the vaccine still is working against all the variants.
Thank you very much for building the confidence among the participants. Sir. This is very, very important, whatever you spoke now, Covishield and COVID variation. Thank you. Why are some vaccines are more expensive than other? How different is to manufacture these vaccines, sir?
Some vaccines are more costly because the technology and the patent, that aspect plays a major role. At this point of time, humanity requires all these to be put aside. India tried in WHO when the vaccine came into existence. They told the other countries, let us give up this patent and let us give the right for everybody to manufacture this vaccine. At that point of time, USA, Germany, UK refused. They said, not possible. We are not going to help you in that. And once again, Indian government had requested, saying that please open up the patent so that everybody can manufacture and the whole world can get vaccinated at the earliest, which they have not agreed. Still, Germany has not agreed. Very, very sad part of it. But in India, Covaxin license or this thing has been given to many other companies, and shortly many other companies, 10 to 12 companies, will be starting manufacturing of Covaxin.
Thank you, sir. That shows the Indian culture. Next question is, if India gets herd immunity, do we need still the vaccines?
Now we should not be talking about herd immunity. We have a vaccine now. Herd immunity, you speak only when there is no vaccine and 70% of the population gets infected, then we say herd immunity.
Okay.
Or for the 40% getting infected and the rest of them getting the immunity. Now it is only the question of taking vaccination. Let us forget about herd immunity now.
Okay. So how often should the vaccine be taken? Every year? We hear that this is not one-time solution.
I already told you about that. The vaccination at present is 2 doses. If they ask for a booster dose will be taken, that will be told in the future. At that point of time, we should be thinking about the 3rd dose.
Okay, thank you, sir.
I can also see some questions here. Somebody has asked about this black fungus.
Yes, sir. I'm just asking in order.
Yeah. Then you can go ahead with that.
Yes. Then next question is, what are the criteria for removal of emergency use restrictions for the vaccines?
Once the entire study is done, because any vaccination goes through phase 1, phase 2, phase 3, the study, all those aspects, what happens, what is the reaction after the vaccination, how long it stays in the body, all those aspects. Once that is done, maybe the emergency, this thing will be taken off and it will be in a schedule. Vaccination schedule.
Next question you have answered, but still I will pronounce. Sir, which vaccination is better? Covaxin, Covishield, or Sputnik?
Both are equally good.
Yeah.
Both are equally
good. Three, sir. Covaxin, Covishield, and Sputnik.
At present, Covaxin and Covishield, I can tell because Indian study has been done.
Okay. Okay. Right,
Sputnik
sir.
claims around 92% efficacy, which is far better than Covaxin and Covishield. Only thing is the study was done in Russia, not in India.
Right,
Only
sir.
if Indian study comes, I can compare the three.
Okay. Thank you, sir. Sir, next question is, if you get the symptoms after taking vaccine, whether it will spread to others or not?
No,
No.
disease doesn't spread through the vaccine at all. Let me tell
Okay.
you, the vaccine which we are using, the Covishield vaccine, is you have taken that spike protein of the virus and we have inserted that. The research has gone in such a way that they have taken one more virus from a chimpanzee called adenovirus. They have taken the genome of that virus and they have inserted the genome, the spike protein genome into this, and they use this adenovirus as a vector. It's a vector-based vaccine. While the Covaxin, it is killed vaccine. So obviously nobody will get infected.
Okay, sir. So next question you have answered, but still I'll ask you, why government change the gap for 2 dose to 12 weeks to Covishield because of production? Yes.
No, it's not
Already
production. I
answered.
told you.
You have already answered. Yeah.
Yeah, it is not
Yeah.
because of production. If it was because of production, they should have increased the gap for Covaxin also. They have not
Yeah.
increased the gap for
Yes.
Covaxin.
Yes. There is a point. Yeah.
The Covishield vaccine is more efficient. You see, before this government rule was put into, wherever Ayagyan's talk before that, I have told people to take after 12 weeks the second dose, because
Okay,
it's they have found that it is more efficient if you take it after 12 weeks, between
Right,
12
sir.
to 16 weeks.
Right, sir. So next question is, sir, could you give a little information on black bus fungus? Is it any way related to COVID virus?
Please don't worry about black fungus. Let me narrate an incident which happened just day before yesterday. What the TV can do us, the misinformation which is given in the news channel can create a havoc. I got a call in the 12 midnight from one of my relative whose daughter was positive for COVID 2 months back. And he says, I think my daughter has black fungus. Why? Because I can, her eyes is watering continuously. Tears are running down her eyes. I said, I was shocked, because you cannot get black fungus just because you have got COVID. You know who gets black fungus? Somebody who is admitted and very severe, admitted in the hospital, who is on oxygen for more than a week, and who is on steroids, and who has diabetes, or even if he doesn't have diabetes, if he is continuously on steroids and he's been given oxygen for more than a week, such patients, serious condition only, you see black fungus. It is not seen in any other individual. Please remember, the news media is creating a havoc. It is creating chaos in the minds of the people. Black fungus is nothing to do with the COVID virus. Black fungus happens because once you get a severe disease, you are given steroids and you will be put on oxygen. When you are given oxygen, humidification takes place because it passes through the water system and comes. Because of the humidity in the nostril, in the sinus, if there is any contamination from the spores of this organism called mucor, they'll grow there and they'll produce this black fungus. This black fungus is omnipresent. In your house dust also it is present. That doesn't mean that you'll get the infection. People who have very good immunity and who are not on oxygen or not on steroids won't get.
Okay. Right, sir. So next question is the vaccine suitable for sugar and BP patients, because there is a death happened due to heart attack after COVID infection, as well as sugar level is increased. Please explain about it.
The sugar level doesn't increase with the vaccine. The only problem with the vaccine, what I told you, 0.61 per case per million, or in UK around 3 per million, they have found clots happening. That's why they have given a guideline. Anybody after taking the vaccine, if you have any issues of chest pain or any other headache or anything, please come and come to the hospital. That's why they have given the guidelines. So sugar and BP patient also can take. It's not an issue. And cardiac patient should consult their cardiologist, because it depends upon the severity of their disease, whether they should take or not. And after consulting their respective cardiologist, they can take the vaccine.
What about the epilepsy patient, sir? Is it okay? Epilepsy.
Epilepsy also they have to consult. because
Okay,
many
right,
vaccines,
sir.
before you take any
Yeah.
medicine or this thing, such patients have to
Okay.
consult their respective
Okay, sir.
doctor.
Okay. So next question is, if one gets side effect of the first dose, then can we take the second dose?
If it is a minimum side effect of body pain and fever, you can go for the second dose where you won't have any symptoms. If at all you get a side effect, many people would have experiences only during the first dose. After the second dose, many of them have not got any side effects. You can go.
Sir. Okay,
It's
sir.
absolutely no problem.
Okay. So there are some questions which you have already answered. I'm skipping them. Next question
Okay.
is, cross vaccination, is it possible in the first dose
No,
and the second dose different?
at this point of time, if you've taken the first dose Covishield, the second dose also should be Covishield. If the first dose is
Okay.
Covaxin, second dose also has to be Covaxin. Just today I saw one article from Spain. They have done a cross vaccination. They have told that it has worked, but at present that is not the modus operandi for vaccination.
Okay, sir.
It should be the same vaccine.
There is one more repeated question. For diabetic and heart patients, which vaccination is preferred?
Yes.
Covaxin, Covishield, or Sputnik? You have answered already.
You can take both, but I would say Covaxin would be better because
Okay,
it's a
right,
killed virus.
Okay. So next question is, Covishield vaccination leads to blood clotting problems. What is the solution for that?
I told you it happens only 0.61 per million in India.
Okay.
Out of 10 lakh, 0.61 means how much? Out of 20 lakh, one patient.
Okay. So when we take a COVID recovered patient, can the vaccination be taken after a month or so?
No, now the government has changed the guidelines. After 6 months, you have to take the vaccine. There is a reason behind it. Some people would have got severe disease, and that when they have severe disease, they are given monoclonal antibodies. If somebody has taken that monoclonal antibodies, you have to increase the gap between the vaccination and the disease state. So now the government has come out with a new guideline that recovery from the disease after 6 months, you can take the vaccine.
Okay, sir. 2D deoxyglucose, give some information you have given.
Yes, that's a very good question. DRDO, it's a medicine which was discovered much before for, it's a nuclear, this thing. If there is any nuclear holocaust for that, this research was done and 2DG was discovered at that point of time. But our scientists found that it can be used for COVID also. And I heard a number of positive news. I got an audio from Mumbai where the patient attendant told that the SpO2, which was around 50% of a patient, increased to 85% when 2 doses of this 2DG was given. Because
Good news.
yes, it's a very good news. It really works, means it is going to be the magic drug for COVID. And many people can be brought out of oxygen.
So next question is little personal, but it is relevant. My wife was vaccinated Covishield on 14th April and suffered chest pain on 15th May after 1 month. Whether to take the second dose or not?
After 1 month, you have to go and consult a doctor. I can only tell you that, because that is a guideline of Government of India. If somebody has taken vaccine and after that they add any chest pain or anything, the first thing is go and consult your doctor. You need to have a thorough checkup and then go for the second dose. That only I can tell you.
Okay, sir. Thank you. Sir, if the person gets severe side effects and if he is not taking second dose of Covishield, whether it causes any effect?
So far, we have not come across any such cases where they have got very severe side effects. The only side effect which we have seen in most of the cases are body ache for 2 days or fever for 2 to 3 days. Other than that, we have not seen any severe side effects. Such patients have been given the second dose. If the side effect is very severe and if there is blood clot, such cases, it will be taken care by the respective, such cases will be addressed to the manufacturers and the people who are doing the work on the vaccine only.
Thank you, sir. Sir, next question is, any update on vaccination for children less than 18 years, as we see many infants leaving world due to corona infection?
No, so far vaccination has not been approved for children, at least in India. We are hoping for the nasal vaccine. If the nasal vaccine comes into play, then that would be the best agent for children. But let me assure you, most of the children who have got infected have not died. They have not had severe disease.
Okay.
Almost all of them have recorded, and most of the cases it was asymptomatic. The infection was asymptomatic. Even then, vaccine for the children at present it is not approved. Study is going on. 12 to 18 years study is going on by Covaxin study for even the injectable one, as well as the nasal vaccine. If it gives good result, that will be in the market for children.
Okay. Sir, even after even for second dose also, we suffer with the same symptoms or different symptoms?
No,
Little.
second dose, most of the time you don't suffer any symptoms. If at all you suffer, you have the same body ache and fever.
Okay. After taking the first dose, if the second dose cannot be given after 45 days, will it be a problem?
I already told you, you can
Yeah,
wait
I
up
told.
to 16 to weeks. 16 weeks means around 4 months.
Okay.
You can wait up to, you're talking about 1.5 months. You have another 2.5 months for the second dose.
Okay. Sir, I heard a doctor saying black fungus by continuous drinking hot water every day. Does hot water these adverse effects?
No. Hot water is nothing to do with black fungus.
Okay. Sir, do the vaccine have problem of asthma patients?
No, at present there is no contraindications as such.
Okay. Sir, a person with history of cancer, can he take vaccine?
That they have to consult because it depends upon what stage they are. If they are on chemotherapy and if their immunity is less, they are not advised to take the vaccine. So
Okay.
it depends on what stage of the cancer and what therapy they are on. So if they are taking monoclonal antibodies, other things, they won't, at the time of treatment, they won't ask them to take the vaccine. So their doctor has to take the call.
Very good, sir. There is a rumor about the risk of COVID positive person taking second dose of vaccination within 2 weeks after proving negative. Please elaborate on that.
I did not get the question. What exactly it means?
1 minute, sir. There is a rumor about the risk of a COVID positive person taking second dose of vaccination within 2 weeks after proving negative.
Oh, rumor about the risk.
He takes second dose.
Second dose.
COVID positive become negative. After negative, he takes the second dose within 2 weeks. Is there any risk?
No, he is not talking about the risk here. I think it's mainly they are saying that he was COVID positive, you took the vaccine, and after that he became negative.
Yeah.
Actually, after 2 weeks, normally everybody becomes negative for COVID. So it may not be because of the vaccine. In some people, it test may be positive for even after 45 days. That doesn't mean that he's infective. That doesn't mean he has the disease.
Okay, sir. So what are the people who are allergic to medications, injections? Can they try vaccinate? Can they get vaccinated?
No, they have to take a special consultation and then they have to take the vaccine. There are many people who are allergic to food. There are many people who are allergic to many other medicines, sulfa drugs and other things. They have to take the consultation of the doctor and then take the vaccine.
Okay. I heard that immunity will go down when the first dose is taken.
It won't go down. The immunity won't be enough to protect you against the disease with the first dose.
Okay. However, the patient who is suffering from neuro problems regarding vaccine.
What type of neuro problem is an issue?
Yeah. Okay.
It
So they
depends
have to
on that.
consult
Your
neurologist.
neurologist has to take a call there.
Okay, sir. How long will vaccine-induced immunity last?
At present, they are saying 8 months to 12 months. It's an ongoing study because vaccination program itself was started around maybe about 8 months back. So they are doing a study. If the amount of antibody comes down, then they may ask for a booster dose, which we are not sure at this point of time.
Okay. Whether vaccination has any problem to thyroid patients? Thyroid.
As of now, if they are under treatment, it may not have any issues. If they are treatment of a thyroid.
Okay. Little tangential question. Any update about third wave?
Please don't worry about the third wave. If I and you can take care of the second wave, there won't be any third wave. If somebody says who is responsible for the second wave, I and you are responsible.
Okay.
Let me
Good,
tell
sir.
you.
You are right, 100%.
Nobody can be blamed. At this point of time, nobody can be blamed for the... I have a very nice this thing which when I showed you in the beginning, you must have seen that slide where mainly it is I and you who are responsible for the... See this. It's very clear. Even the virus has I and U.
Yes,
If
sir.
you
Yes,
want
sir.
to
Yes, sir.
break the chain,
Very meaningful.
if you want to break the chain, please remember that physical distancing, mask is a must.
Yes, sir.
Only I and you can break the chain.
Yeah,
Don't
yeah.
worry about the third wave. If you take care of the second wave, and after the second wave, you take all the precautions which has to be taken in a military way. I'm talking about in a military way. Absolutely, you cannot have a third wave. But
Very good, sir.
every day when I see people roaming around between 8 and 10 a.m. in the morning, because they are given a free time to go and buy vegetables, it looks as if the people are thinking even the virus has taken an interval. They all think that
Very,
when
very sad.
10 a.m. virus is not there, it is said I won't infect, so we have come out, and 10 a.m. we'll go inside because after 10 a.m. virus comes out. That is the way
Yes,
people
sir.
are roaming around. If
Yes,
I
sir.
can buy vegetable for 1 week, why should I come every day out of the house?
Yeah.
So,
So next,
and if the government has a guideline, if they say please only allow 50 people to come to a wedding, who made it 500? Who made it 1,000? You and I made it 1,000. You and I made it 500, isn't it? The guideline was there. Narendra Modi
Okay.
never said remove the mask and run wherever you want. We did not follow it. We jumped the gun. We jumped the rules also. We broke the rules. We gave BBMP saying that only 100 people will come for the function, and we cheated them. 1,000 came without the mask.
Yes, yes.
That's how the virus spread. It
Yes,
spread
sir.
in geometric progression this time. None of the country in the world could have faced it. This Hercules job of treating the people when a case from 10 increased to 10,000.
Yes, sir.
It is impossible for any country to do it.
Okay, sir. So next question is, how about the ANC women, the people who are on infertility treatment, can they get vaccinated?
They have to consult their gynecologist.
Okay.
Pregnant
Right,
women
sir.
have to consult. Lactating mother, normally vaccination is not given. Pregnant women also, after there is some clause and this thing which the government of India is given to all the gynecologists, that has to be followed. It has to be your respective doctor has to take a call.
Okay. It is also one particular personal question. After getting vaccinated with first dose, when it is advised to get laser treatment or surgery for cataract?
There is nothing to do with laser treatment, the vaccination, this thing. You can get it done at any time. That won't hinder you this thing. Only thing is blood donation you are not supposed to do till you 28 days after the second dose. Now it is decreased to 20 days or 14 days.
Okay.
Other than that, if any other problem is there, you can go ahead with your treatment. It's not an issue,
Okay.
except for cancer and other things.
Yeah. Little out of way question, sir. Is continuous steam inhalation cause lungs damage?
It may not cause lung damage. See, our mucous membrane is very, very sensitive. There are some people who take steam every day and they put Vicks, they put all unwanted menthol, this. You should not be doing that. That will cause injury to our mucous membrane if you do it very often. This is something anything too much is too bad.
Okay, okay.
Even your kashaya also. Many people drink kashaya as if it is some tonic for every half an hour, and then they complain of acidity, gastritis, piles, because you know what the ingredient of kashaya is. It has to be taken only once or twice a day, not 10 times a day.
Okay. Sir, is smoking and taking alcohol affects the body after taking vaccine? They are worried.
No. I'm not
Okay.
somebody who promotes alcoholism, but at least let me
Yes.
tell you, alcohol is nothing to do with the vaccine. That's why, believe it or not, some of our healthcare workers did not take the vaccine because at that point of time they told after vaccination 45 days you are not supposed to touch alcohol, which is wrong. There's nothing to do with vaccination.
Yes, sir. So next is, why each doctor has different perception of COVID?
That's because it's something which is new and which keeps changing very often. You must have seen the symptoms of the disease itself has changed from last year to this year. Last year the symptom was a little different. This year people have different symptoms. They are complaining of loose motion. They are complaining of conjunctivitis. These symptoms were not there when the last year when the disease came. So obviously the treatment pattern also will change from doctor to doctor. But after after you come to know about the entire disease, then you know everybody will follow the same protocol for treatment, which is going to happen shortly.
Yes, sir. Good, sir. Sir, can't we ban media for scaring the people and misguiding?
Now itself we are called Hitler. Imagine what is our condition if we ban the media.
Yeah.
We should not be banning media. We should boycott media.
Okay.
If you boycott media and if their TRP goes down, automatically this program also they won't make. Why they are making this program? Because more and more people are watching it.
Okay.
Because they find that their TRP has gone up when they are shown. When there is one body, nobody sees. When there are 20 bodies, everybody wants to see that. If we boycott, automatically they'll stop showing such programs.
Yeah. Okay, sir. Sir, do you have any statistics of death rate after taking first dose and second dose, or ICU cases?
Death rate, no, but I showed you about one slide on the side effects. There it has given. I already told you about this. Very severe side effect was seen. Here you can see this. Very severe side effect was seen. 0.61 per million doses.
Very less. Very less.
Very less. And it was 4 cases per million in UK and 10 cases per million in Germany. But in India, it was very less.
Okay. Sir, after taking the first dose by mistake
Yes.
and getting positive, and after 1 month after getting positive, if the second dose of Covishield is taken, any danger or neutral?
Nothing, no danger. If you already taken, don't worry about it. If you are not
Okay.
taken, wait for 6 months and take the second dose. If you are already taken, nothing to worry.
Okay. Sir, there are a few questions which are already answered. I am purposely skipping them. And more than the questions, people are appreciating your knowledge and the way of answering and presentation. Thank you very much.
Thank you.
I
I'm
think
just showing you I'm showing you a website which gives the daily statistics, because people are saying people are dying. There is corpses on the road, all those things. Let me tell you, you can see the death rate there, case fatality ratio. In Karnataka, it is 1%. Highest is in Punjab, which is 2.4%. You can see that. Highest. And in Kerala, it is less, 0.3% or something. Average death rate, if you calculate, 2,83,335 divided by 2 crore 19 lakhs 81,000, it will be around 1.2 to 3%. That is the death rate in India. Last year it was around 2%. This year at least the death rate is low in terms of percentage. You are seeing more number of deaths because more number of people are getting infected.
Good, sir. Good. Dear participants, today's program is already uploaded in the YouTube. So the link is pasted in the chat box. Please fill the feedback form to get the participation certificates. We'll wait for 1 more minute for the last question to appear. Otherwise, I request Dr. Girish to propose vote of thanks. We'll wait for 1 minute, sir. Is it okay, sir? Is it okay to wait for 1 minute for the last question, sir?
Yeah, no issues.
Okay. While filling the feedback form, please give your correct email ID. That's very important, so that we can communicate with you. And the person for contact of the office of Swadesh Vignan Andrelana, Sri Ramesh number is also given. If you have any questions or if you have any queries, please contact him personally through phone, or you can write to us through mail. Thank you.
I just see a question here. Somebody saying that because of lack of Covaxin in the village, we are not able to take the second dose. Don't worry. Whenever it comes, you take. It will not have a major change in the amount of protectivity which is giving to you.
When this pandemic ends, sir, they're asking.
Pandemic is not something which will end. It will drastically, incident will go down and it will become sporadic. That is what happened with respect to 2009 H1N1 swine flu. It was a pandemic. At the time, death was not so high, so nobody spoke about it much. But today also we have sporadic cases of H1N1. And this pandemic, coronavirus will be there with us for a long time to come. Because it's an RNA virus, it keeps changing. It may come in some other avatar. We may have another virus shortly. Re-emerging diseases can come. So diseases are as long as humanity is there, diseases will be there. There
Sir,
may be
thank
some
you.
other pandemic.
Yeah.
Our lifestyle we have to change. Our food habits we have to change. Our way of thinking about our environment has to change. Why this virus came? Because the Chinese people eat whatever which moves, and it came from the as we know, from bat to some other animal to humans. When such things happen, there is a drastic mutation which is going to happen, and that is the one which has caused the problem. For that matter, even HIV virus was not a human virus. It was in chimpanzee. In chimpanzee, it came to humans. And even today, we have HIV, even though it was there from 1983.
Yes, sir. Yes, sir.
Lakhs of people have died because of HIV also. So whenever you do statistics, all the disease looks very dangerous. If I give a statistics of HIV, you will have a shock of your life. More number of people have died of HIV. More number of people have died of tuberculosis. More number of people have died of malaria. But now we are only bothered about COVID. Once this goes, we have many other diseases which is going to come out of the pipeline. We have to change our lifestyle. That is the only thing which can help us.
Sir, last question by Dr. Y.S. Gayatri Madam. Namaskara, sir. There was a news in TV9 2 days ago about the side effects of Covishield. How safe is to get vaccinated? We are all confused. Please guide us. You already partly answered that question, sir.
I already told you, don't see TV for another 2 months. Any disease or anything, you have to come out of it. 50% is your willpower. Namma atmastairya mukhya. 50% is medicine and doctor. If you lose that 50%, you're gone. That is what is happening. I see people who are in ICU. When I have gone into ICU because somebody who is close to us in the hospital, if they are there, we go and see them, see their condition. I have seen many people's SpO2 going down when they see somebody else is struggling in the next bed. This is a human nature. So whatever side effect about the vaccine they are talking about, I already told you, it is negligible. Even if you take crocin also, you may have side effects. Some of them can have side effects. So it is negligible. Don't worry about it. Take the vaccine.
Sir, thank you very much. Thank you very much for clarifying many questions. I think we all got confidence to go for vaccination so that our country will become disease free in another some weeks. Thank you very much. Over to Girish, please. Over to Dr. Girish.
Good evening, all. Thank you, Radhakrishna sir. Thank you for giving me an opportunity to propose the vote of thanks in this August audience and the topic, and a very relevant topic for today's need. In fact, entire community was reviewed from the science, from the technologies, from the support of the scientific world. So COVID vaccination myths and truth. So this was a wonderful topic, and it was apt, and I really appreciate the recommendation of the committee which recommended Giridhara Upadhyaya sir, because you have done the right justice for this topic, sir. So thanks a lot. Your comment on the topic was so very apt, and it was so knowledgeable, and it was opened all of us, eyes of all of us, and that was very important for today's thing.
Thank you.
So on behalf of SVAK and all the participants who got benefited hearing to you, and they have really now got more confidence on the scientific world, and support from the government and all. Now you not only removed the myths about vaccination, but many myths about the COVID and today's contemporary practices. Okay, that was really wonderful, sir. Thanks a lot for accepting our invitation to be the speaker today, and you have done the right justice for the topic today, sir. So thanks a lot. And, really, I need to thank Radhakrishna sir, because he brought the name of the speaker and today's entire coordination he did, and he very systematically drew the program today. So thank you, sir, for doing all these things. And I also back end thank Renuka Prasad sir, and mainly first let me thank our founder patron K.I. Vasu sir, because he is our backbone and all his blessings are there to run continuous programs. As in Umesh sir told that about SVAK and its activities, we have been doing a lot of such scientific sessions, and this was one wonderful one sessions, which is mainly on a voluntary basis what we are doing without any kind of a financial expectations. We are doing mainly because to disseminate the knowledge of Shastra and science together in an integrated way to the community for the benefit of the community. So I also thank Umesh sir for giving the introduction of the SVAK and Giridhar Upadhyay, previous speaker. Wonderful introduction sir has given. Thank Ramesh ji, who is again back end of all these such programs for coordinating these programs. And nevertheless, I should always thank about the SVAK Bangalore team, which took the strong decision of today's topic. In fact, when we go details about the today's topic and discussions, I think all of us have to forward the link of today's presentation, which is uploaded in the YouTube, to many more people, because this information is very, very important. It has to reach many people. And I really happy that more than around 200 people in live in the WebEx, and more people are already live watching the YouTube. So, but it has to reach many more people, not only Karnataka, but all over India, so that people get confidence. Not only we getting this benefit, others also could get benefit. So I request all the participants to forward the link of the today's presentation, which is there in the YouTube. So again, all the participants, I thank for their active participation and the right questions. So this maybe the sir has given the lot of information, but the questions were very, very important, because those were the questions which was there in the many people. Okay, in fact, directly one of the questions I asked, sir, Giridhara sir, I also took the first dose of vaccine, and the Covishield I took, but 2 days later I developed a mild swelling, which all my colleagues at SVAK also have seen. I had a swelling in my face. Okay, we can call it as angioedema, allergic angioedema. Maybe again, as you rightly told, 0.61% in a million. Maybe I was maybe a part of that. Okay, but I am confident that it will not last for more. And now you are seeing my face, and I am very clear. So it was for a shorter I had, but as a doctor myself, I did not let down my confidence. Okay, I am going to take the second dose after, as you suggested, 12 weeks. I will wait for that, and I will definitely take it, because I have been my moral boost again was enriched by your talk, sir. Thanks from my end also.
Thank
So
you. Thank you.
all the participants, all the SVAK members. Okay, I'm thanking you again, sir. I take this opportunity to thank all the members of SVAK all around 25 districts of Karnataka, because they have spread down this message of today's session to their friends and colleagues. So thanks for all the members of SVAK and all the participants again. I request all the participants who have not joined the SVAK, please join. It is such a platform, such a wonderful place where you are a part of disseminating right information to the public selflessly. Okay, so that's very important. So, and I would like to end my talk by repeating the statement what Giridhar Upadhyay sir told. I and you are mainly responsible to break the chain. Not only breaking the chain, but to keep our community healthy, fit, and preparedness for future coming more challenges. COVID may be a smaller one, but we don't know, because of our lifestyle and our greediness, what we are doing on this mother earth and on this environment, which we have to face it back, but we have to be prepared. I also saw today newspaper morning that due to the cyclone effect, what has happened to the western coast. Maybe this is another thing which we are also facing. So there are nature's reactions in a different way. So we have to change our lifestyle. We have to change our responsibility or responses towards the nature in a more friendly, as a we are in the same ecosystem. Okay, so we have to be we will be benefiting if we help others and we keep our nature safe and healthy for our future. So with these words, I thank one and all the backend team, IT support, and all the staff member, SVAK members, including the executive committee members who have taken a lot of efforts in conducting this program in a very successful, systematic way. So thanks one and all. Over.
Thank you. Thank you all. Shubharatri. Dhanyavad. Namaskara.